one of my favorite local doctors. Always a pleasure to get him on the show. Buckle up, guys. Here comes Dr. Vince Akimoto.
Hey, you said Felix was your favorite local doctor.
Oh, did I say that?
You're my favorite doctor.
Yeah.
Okay, I'm Sabrina's favorite doctor. You already got Felix as your favorite.
All right. Well, you can
He's
be
one of my favorites too.
You'll
He's
be
a
my
great
co-favorite. Co-favorite.
All
Doc,
right.
man, you've
Yeah,
been
like a co-parent. We can co-parent this together. I'll get him on the weekends.
Right on. Doc, I'm glad we're able to start on a little bit of a light note, but you serious business. Late yesterday afternoon, I know you were, one of the first to really kind of impress upon people that we were going to see big numbers, and we saw the biggest numbers ever on Guam twice this week, right?
Yeah.
So
3 times actually.
Right.
I mean, we've set all our records have been set this in the last 7 days, and that's concerning. But realistically, this was going to happen, and unfortunately, we're going into a very extreme lockdown because I think we just realized that there are a lot of things that we still need to do in order for us to be safe in dealing with this virus. I mean, I think the governor and the people in charge of the hospital are truly alarmed, and they're not lying. I mean, this is a bad situation. People need to be very careful about getting critically ill. So there's no game, there's no drill. People are dying. So every death is a big deal, and we really hurt for families that are losing their loved ones during this time, because as you may have heard from, I think it was public health, there's somebody assigned to make sure that COVID-19 deaths are treated a very specific way, which is not consistent with our Chamorro culture.
Right.
So this is where the rubber meets the road. This is what we were trying to prepare for, and if we could avoid, which is where the hospital gets overwhelmed. But because there are inherent structural weaknesses in our public health system and in our hospital, the people of Guam are paying the ultimate price today, which is you've now lost your freedom. So it's a bad day, but it gives us a chance now, because most of us are still safe and are recovering if we are sick, to decide what we're going to do next. And I hope is that we're not going to squander the next 3-4 months, thinking magically that public health and Guam Memorial Hospital is good enough for Guam. It's not good enough for Guam. We can't keep ourselves open, and we therefore cannot open to tourism or open our schools. So this is a bad day, but the numbers themselves, which are causing the panic, were anticipated, and they don't have to shut down Guam, but they did. So a lot of senators should be waking up this morning, people who maybe thought that the last 6 months were their chance to renovate their house or run up their Home Depot credit card bill. If you were one of those 5,000 people that stayed home a lot the last couple of months, you might want to find something useful to do, because of you and many, many other people, we're going back into lockdown. Nobody worked hard enough. Nobody did enough, including me and Dr. Cabrera. We're all guilty, because now the children of Guam get to see what a lockdown looks like. And there's going to be domestic violence. There's going to be angry doctors. There's going to be angry patients. Now, this sucks.
Doc, you talk about the hospital, right? But what about the clinic level? I know that at least in you guys' case, have you guys been inundated and overwhelmed?
Yeah, it's been a rough 6 weeks. That's why we knew this was going to happen. I mean, on the clinic level, we're seeing all the people that don't want to go to the hospital. On the clinic level, we're seeing people that are scared that they have COVID-19, but they don't want to change their lives, where public health suddenly throws them into quarantine, or their boss tells them not to come back to work because they're an at-will employee, or, they're a small business owner, and, how are they going to shut down their business? They just opened it and they're in debt, So a lot of tragedy, a lot of realities. We ain't kidding. We didn't make any of this stuff up. This is real life, man. So in the clinics, we're seeing, probably 80% of what the hospital sees is being seen in the clinics. we're just not seeing the deaths. We're not seeing people struggling to breathe. The people in the hospital are watching people near death. It's been a long 6 weeks for our nurses and our doctors who work in the ICU and work in the respiratory centers. You know, there are a lot of heroes, right? I mean, there's so many heroes, but it still goes back to the fact that the people that you're going to go to when you can't breathe are still working, and they haven't stopped working since March. So this is not good, and no one should be thrilled today that the numbers are up, and nor should they be thrilled that they were right in their predictions about how many people were going to die or how many cases were going to happen. This all sucks, man.
Doc, where are we with the backlog of tests? I know that you guys had run a bunch of tests over the weekend. We heard from Public Health that there are 1,500 swabs sitting in a freezer somewhere. So what's with you guys? Are you guys having a backlog? Because I know you kind of do some through DLS. So what's the status on that?
Yeah, you know, there's so much testing going on Guam right now that, you know, people need to appreciate the metamorphosis in our medical capabilities. We have multiple labs doing PCR testing, which is space age kind of stuff. I mean, it's routine, but we didn't have it until March.
Right.
We couldn't do these tests. It would take weeks, maybe months sometimes. So for us to be complaining that we can't get a test back in 7 days, I mean, pardon my French, but that's a white person's problem. You know, it's not because we can't get our tests back. You know, that's not the problem. The problem is we can't control the spread of disease. And if we're waiting for a test to do that job, we're idiots. I mean, I'm going to try not to use any foul language because I think the FCC left me a text message about my mouth last time.
You weren't the only one.
But the deal is that it's not the technology that's failing us. It's not our inability to bring back these very sophisticated test results. It's our ability to control the spread of disease in our community and the ongoing infection of people in the community who are going to have a really hard time when they get sick. So it goes back to the basics, like Dr. Shea's been saying, the 3 W's. I can't remember what they are, but there are 3 of them.
Wear a mask.
You can go to his website.
Wash your hands.
There's all these things, right? Yeah, everybody knows what they are. But the really biggest thing is you got to care. You got to care that what you're doing is going to affect you and affect the other people, me, right? So when they make excuses as to why they're going to go to the bar and kiss everybody in there and then get drunk and then, you know, run into a pole. So the thing is, they run into the pole, they still take up a space in the emergency room or the ICU. So whatever your reason, whatever your motivation for doing what you do, just understand that we're all in this together. And I think there's only one ICU bed left in the hospital, unless they go to surge capacity, unless we get the military to come in, unless we start doing things, which I hope we've already got a plan for. So you can ask Lillian. And again, I'm going to just reemphasize, there are a lot of really great people who have not had a single day of rest through these last several months that we've been through this pandemic. And now you just their job just got harder. And at the very top of the list is Lillian, right? I mean, no disrespect to Linda DeNorsi, the former public health director, but she was my previous star in the government of Guam. But, you know, Ms. DeNorsi is no longer with us. She retired. But Lillian is there, and she's been there, and she's been taking a lot of abuse. She's been taking a lot of criticism, but she shows up every day. And a lot of times the first thing she does is she goes to the emergency room and she acts like a real nurse. I mean, she goes in and does nursing stuff, which sounds easy or like out of, you know, just what you're supposed to do. But no, not everybody is as hardworking and honest about what they do as Lillian Posadas. So she's a great woman. I hope it's a great interview, but I suspect she didn't sleep much last night. I didn't sleep much last night. A lot of our doctors didn't sleep much last night. A lot of nurses were up all night. And so we're going to try our best to get back to some better normal, better state. But people just need to care about the fact that, you know, there's a lot of really good people working hard with really good technology and equipment. But it is going to take this community doing some really tough things. And I'm not talking about washing your hands. I'm talking about being willing to see the layoffs of 300 people at Guam Memorial Hospital who don't need to be there, and they're sucking our hospital dry with their payroll that hurts us. We can't hire nurses, we can't hire respiratory therapists, we can't do the basic things because we're broke all the time. I'm talking about changing your senators who just want to pander to your politic, right? Elect somebody who's going to work harder than the guys who are in there now, who have yet to address this pandemic. They haven't done a damn thing. They have not spoken one moment about spending local funds to help the governor and her team make this better. Now they're going to be challenged to raise $6.3 million to match the Trump 75% so that unemployment on Guam isn't going to be as terrible as it already has been. I'm not mad. I'm furious.
Doc, we have a comment in here from Nurse Margaret. Thank you, Doc. Most healthcare workers are tired. We're not home with our families. Everyone else should do their part. Please. Justin writes in, yep, my other half has been working 7 days a week for the last 5 months. And these are common stories, right?
This is, I'm going to assume that most of those people are at either public health or the Guam Memorial Hospital. What we need to know is we have a very good group of nurses and doctors on Guam. It's historic as to the quality and the quantity, but it's still not enough. I mean, for this pandemic, even New York City needed to bring people in from Florida. Even Texas needed help from their friends. Everybody needs help from their friends when we're in the middle of a existential threat like the coronavirus pandemic. And then we need to pick ourselves up so we can help Saipan, so we can help Palau, so we can help our neighbors, right? We need to get this right so we can help others. And I think we have the resources to do it. So what's missing, right? People keep saying, you keep complaining, you don't give answers. No, I give plenty of answers. You just don't like my answers. We said to put the money into renovating the hospital so that it would be good enough for Guam, get it accredited. Quit making excuses about why you didn't fix the electrical panel or their cracked concrete roofs. I mean, the litany of what they didn't do, will send people to therapy. So it's not true that there's just complaining without any specific fixes. What is true is the politic on Guam has thus far brought us to this point. You care more about your pari having a comfortable job in the government so he doesn't have to worry about being laid off. You worry more about how many votes you're going to lose if you decide to say the word layoff. Government layoff. Lay off 300 people, put them on unemployment so that the federal government can pay for their existence. That's what you did to the people at Docomo, at GRMC, and in all the hotels. There have been massive layoffs in the private sector, and not a single senator has done a damn thing about it.
Doc, first of all, thank you for acknowledging.
I almost said asshole. I almost said that, but I held back.
Doc, thanks for sharing who you believe are the heroes and talking crap about
Villains.
Guam's.
No, just put it. The villains in this are our senators.
Right, your heroes and your zeros. So, but can we talk about what are you hearing about the state at Naval Hospital? Have you heard anything at all?
No, I haven't heard anything at all. And if I'm the admiral, you're not going to hear anything from me. I mean, they got a big problem themselves, and they got to take care of their own. That's their job. They've got a mission. They're here for, they know what they're here for, and it isn't to worry about you or me. I mean, they're good neighbors. It's been amazing. We've helped them. They help us, but we got to do this ourselves. To think that Uncle Sam or the military folks are going to save us. That's called magical thinking. You're a unicorn if that's what you're hoping for. And the thing is, the majority of the doctors, not including me, but I mean, I'm a product of growing up in Upper Heights down there in Santa Rita too. But we all come out of that military medicine background. There's a lot of doctors who were working up at the Naval Hospital.
Right.
So it's not that those guys have to come outside the fence to save our sorry butts. We need to do this ourselves. Everybody is in position to make this happen. It's the leaders who have to decide, do you have the political will to save your island? Or are you going to withdraw back into your hermit crab mentality is, I got an election in 7 or 8 days, so I'm just going to do the safe thing, the thing that's going to get me elected. Well, I hope that gets you unelected. So as long as I got this soapbox, everybody needs to vote out the incumbents. And that's simply by voting in new people. There's a bunch of really good, new, scruffy people that want to take over this government and do a better job. So lucky for you, you got a choice. You can choose what got us here, or you can choose what's going to get us out. New thinking.
Doc, you know, people talk about the chronic diseases that, you know, we weren't seeing in the first part of the lockdown, and all the doctors we get on, they're talking about this surge of those type of patients, non-COVID related illnesses, whether it be, you know, diabetes, strokes, heart attacks, and all those things. What's your message to those people out there who are kind of living with these conditions as we get ready to head into this stricter lockdown at noon?
I'm sorry. I'm sorry that we didn't get, you know, the governor and the legislature and the Guam Memorial Hospital Board of Trustees convinced that they needed to get the hospital accredited, and that we couldn't get them to get the critical care units more robust to absorb this surge. I'm sorry that while you're having your heart attack and stroke, you're having to deal with the news that, you know, a coronavirus patient's coming in dead on arrival, or they're going to have 2 people next to you that are on ventilators. You know, they're telling us that they're keeping them apart, but it's impossible. That building is so poorly run and maintained that, you know, let's just assume that the Joint Commission wouldn't accreditate us today. You know, the safety issues at the hospital are real. There are heroes in facilities, people that deal with housekeeping, people that deal with the food. They are just breaking their backs to try to make a bad situation good. So I'm sorry to them too, because of my failure as an advocate for better care, and I've been doing this for a little while, right? These people that are having their stroke, that are having blood infections because of their dialysis, they're not having a great experience this week, and it's going to get rougher this weekend. You know, the real question is where are we going? What's the number going to be in the next several days that's going to freak out the community? Because it seems like that's the only thing that wakes people up. That number doesn't really matter as much as what's happening in our community that allows it to happen, which is, you know, a complicated thing. But what it winds up being is we're not prioritizing basic health care. We've been paying for other junk. And I hope the governor got sleep last night. That lady is working super hard. She took a bullet. I mean, she got sick herself, but she still has to wake up and do her job, you know, and she's not going to get a work excuse. So, you know, for senators to criticize, and they took the day off, they've taken like 3 days off, and then they got house calls to get their nose swabbed. And they're the epitome of why we're here. They treat themselves better than the rest of us. Vote them out. They're terrible.
Doc, is there anything you can say? You know, we're talking about, you know, our physical well-being, our healthcare, but what about our mental health? Do you think we need to, I'm not sure what that is. Do you think we need to put some focus on that? Because it seems
I think they have, you know, to the credit of this administration. And, you know, again, I'm a critic, I'm a fan, but even before this all started, mental health was already ramping up its outreach because they realized that there had been more suicides, that there had been more undertreated mental disease. Mental health has not been sleeping. And these people have quietly endured a lot of abuse. They've quietly endured a lot of threats, physical and emotional threats, because it's a rough time for people with mental illnesses who are having a hard time getting their medicine because they're scared to go, you know, anywhere. So mental health is, as best I can tell, doing what it can. But you know, mental health is another broken part of our healthcare system that many good people are trying to hold up. So let's focus on one thing at a time in terms of fixing it. If I had a dream, if I had a wish, it would be to have GMH be the focus of all our government's resources and attention.
Yeah.
And no more slush funds. I don't give a rat's ass about GVB. We ain't going anywhere. Put all the money that GVB was planning on spending on some stupid party, put it into the hospital. And what are they going to spend it on? Nurses, respiratory therapists, people that are going to do the work of taking care of patients, not buying some fancy, smancy, blow up, glamping, you know, ICU unit that's going to sit out in the parking lot. Are you still there?
We're here.
Yeah.
Yeah. The thing is that this stupid attempt to make us think that you are working when you, at the very last minute, bring out this catalog picture of an Alaskan glamping tent. That's the corruption I'm talking about. That's ridiculous. You're going to spend $900,000 buying something that doesn't have any nurses in it. You're an idiot. So let's just pull it back, be real. This is like that guy that always comes to the barbecue. He never brings any food, but then he starts criticizing, oh, this Kellywood's not so good. Oh, the marinade. This is a bad deal. And you have some bad politicians running this pandemic. Kick them out. And I'm not just talking about the senators, right? Everybody needs to get more serious about this. I mean, I know there's a lot of people working really hard, like Lillian, like the governor, like a lot of people. But then there's a lot of people who still think that this is an opportunity for them to make some side money, right? Do some side scams like selling masks for, some stinking big amount of money. There's always going to be leeches in our community, right? It's a good time to pick them off. This is a life or death situation. We got to get better. And usually we do, right? Typhoons, they always blow away the scum. And then we're left to pick up the trash that they left behind. But we're not going anywhere. This is our island. Nagas Guam.
Amen, Doc.
Thanks, Doc.
Thank you.
All right, stay safe.
You want to call back at 8 or what?
Ooh.
No, I think I've done enough damage.
I always
No, you didn't.
We ain't done
How's my
until
hair?
you say,
How's my
"Egypt."
hair?
Yeah, look at that hair.
Okay?
Is that gel or is that a haircut?
It's all gel, man.
Good luck,
Special
Doc.
effects.
And thank you, okay?
Thanks, Doc.
All right.
Bye.
Dr. Vince
Bye-bye.
Akimoto, wash your hands. 7:34. We're going to take a short break. It's the Link on the Breeze, 93.9.
Zeros and heroes.